Good morning, everyone, colleagues and professors. I would like to thank to the committee who have invited me to the wonderful session. And I just want to share about the survey that I have about the need and perceptions of medical students in psychiatry. My base is in Faculty of Medicines. I work as a lecturer and the head of unit research in that university. This is the private university in Jakarta, the Krida Wacana Christian University. So the point is why I did this survey is because we know some of the students still consider psychiatry as a non-scientific and to be difficult for them. And medical students sometimes think that this country is difficult to understand. It is because the term, the diagnosis, how to make an interview to the patients, even about how to gather information from books or from models they have. And sometimes they complain about it is very hard to diagnose mental disorders to the lack of physicals and laboratory findings. We know since that there is no other medical, laboratory findings or examinations who can precisely, act as a contributing factors of the diagnosis of mental disorder. So the objective of the studies is to know about the perceptions of medical students about psychiatric lectures, and to know about the need of medical students to understand psychiatry. And for us as medical educators or as lecturers, we want to get some information from the students about how to delivering lectures in the future, whether it is one-on-one or even a role play of that, something like that. So this is the internet-based survey. I put a survey in the Facebook group to one of my groups in medical students, and students must have completed psychiatric blocks. This is the psychiatry modules in our university, and the data collected by the surveymonkey.com. This is the independent internet-based survey tools. There's most of us knows that the surveymonkey.com is that. This is not only for the monkey, actually. So I asked the questions in the survey, do you interested in psychiatric lectures? Surprisingly, 75%, more than 75% students interest in psychiatry. This is good, right? And when we asked about which topic psychiatry that you think that this is the most interesting one, depression, schizophrenia, and also the anxiety is the third of the most interesting subjects, or topics in psychiatry that they can remember, or they can think that it is very nice. And I, as a psychiatrist, also very happy because they think the CLP or psychosomatic medicines is to be the fourth interested in this topic of psychiatry. And when we ask about what do you think about psychiatric lectures, whether it is interesting, boring, or neutral, most of them say that yes, this is interesting. 63.6%, about 100%. So this is the blind, I do not know who is it, or I don't know who will be the respondents. This is a blind study, so it never related to the marks of them, so they can choose anything. Okay. And when we further asked about, are you interested in choosing psychiatrist as your career? Yes. More than 50% of the respondents say yes. So I think this is about how can we manage, because some of them, we know that the medical student, when we ask the questions about, are you prefer to be a psychiatrist for your career? No. I prefer to be the internal medicines, the OB/GYN, specialists, or even the pediatricians. And choosing psychiatry as a career, I think it's rather difficult to be uh, the one who prefer for the medical students. But when we specify what kind of specialists in medicine most preferred by medical students, this is, we call it, this is the essay questions. It's surprisingly, psychiatry is to become 22.2%. The first one is the pediatrician. Oops, sorry. And it is, the psychiatry is 22.2%. It is above than OB specialists and internal medicines. And when we asked again about topic in psychiatry that you remember most, still with the same, with the psychotic, depression and anxiety is the third most remembered topics of psychiatry that the students remember this particular subject in medicines. So, actually this is the end of my slide. When we asked about how to gather informations, how to deliver psychiatric lectures in the future, we asked the students who have completed the blocks of manual of psychiatry what they suggested, what are their suggestions. And they suggested, we want a real patient from clinic as a vignette case. We don't want a DSM or ICD-10 vignette case, because sometimes it is too idealistic, kind of like a very vivid and very real. But sometimes when we go to the clinics, we don't have any kind of that. Sometimes it's very difficult to find the good, appearance of the patients. And they asked me to have a video symptoms of psychiatric disorders. Can you explain the mood symptoms in the video? How can we describe this, the anxiety mood, or is this anxiety or depression mood, or this is a psychotic? What can be the good? Because when we talk, when the teachers talks about, oh, this is the mood disorders, depression was like that. Depression, okay, sad, moody, blue. What kind of affect is that? What kind of affection is that? And then they also want to do role play. They like to role play. They want to be an actor, kind of like I want to be a depressed patient. How will it play out? It is because they can feel the empathy of dealing with the patient, dealing with the mental disorder patients. And the most interesting one is, I think, is they want a guest lectures, patient as a guest lecturer. So they want some of the patients from clinics or even from inpatient clinics come to the class and teach them about how they feel becoming a mental disorder patient. How they feel about what is the hallucinations. Can you explain about the hallucinations from the side of the patient, not from the side of the doctors or the psychiatrists? And this is very interesting. And we can do this maybe related to the ethical clinicals or to the human rights. We have to discuss about it before we come forward to fulfill these suggestions. I think this is for my presentations. I hope you can gather information from this survey, and I hope it is useful for us as a lecturer. Thank you very much.
Thank you, Dr. Andi. I think it's very interesting topic. So, from audience, any comment or question for Dr. Andi? Maybe you also do the same survey in your university or faculty. Is there any comment? Maybe Dr. Patrick can give any comment. Please, Dr. Patrick.
the subject of your study and the characteristic of the student. This is a practical students.
This is mixed between the preclinics and the clinical ones. So the inclusions criteria is students who have completed psychiatric block. So we know that psychiatric block is in 7th semester, and after that they have a clinical clerkship, then psychiatry. So they also can do the survey, candidate survey.
Our experience in University of Indonesia, the psychiatric clinical practice module is conducted in the 7th and 8th semester, semester 7 and 8. And the students in this module are also having methods of learning such as role modeling, and then said about the video of the psychopathology of the patients, and they get this information about the video when the students are in the preclinic. In the preclinic stage, it is when they are in the neuropsychiatric module. They learn about the psychopathology. They learn how to do the psychiatric clinical interview, and they learn how to do the counseling and